There in Congress in the US, and we can speak now to Sean Casey from the International Medical Corps. He's just returned to the UK from Liberia, where he was setting up an Ebola treatment unit in the country. Welcome to the programme, Sean. How would you describe the healthcare facilities there when it comes to controlling the epidemic?
Well, in Liberia, the healthcare facilities are quite basic. Our Ebola treatment unit that we opened about a month ago is in the forest down a dirt road next to a leper colony. It's very simple, but our healthcare workers are safe because we follow simple procedures. They're trained, they have the equipment that they need, and we pay constant attention to infection control to make sure that nobody gets infected.
Okay, and how would you describe those basic measures as you describe them that you use?
Right, it's quite simple, actually. So everybody is trained to use personal protective equipment. It includes coveralls, hoods, goggles, masks, gloves, aprons. They're donned in a specific sequence to make sure that no skin is exposed. They're doffed in a very specific sequence that includes 20 different steps and hand washing in between each step to make sure that the doctors and nurses and other staff don't contaminate themselves. There's no high-tech equipment. It's simple procedures and washing hands with chlorinated solution after every movement.
I mentioned that you'd just come back to the UK. What type of screening process were you put through on your journey?
Arriving here, almost none. I landed in Gatwick today, and it seems the screening procedures have not yet been rolled out there. Upon leaving Liberia, I was asked to fill out a form, basically as a self-declaration of whether I had a fever, any other symptoms, if I had been in contact with patients. My temperature was taken several times. I had to wash my hands several times. But in transit in Casablanca this morning and on arrival in Gatwick today, there were basically no screening procedures. There was another temperature check in Casablanca, but no questions were asked.
But what sort of procedures do you think one could realistically put in place? I mean, the disease obviously doesn't develop immediately, so the practicalities are pretty challenging, aren't they?
Right. Well, people are only contagious when they develop symptoms, and that usually includes a fever. The most effective screening procedure is probably a temperature check, but also self-reporting is useful. If people have had contact, if they've had symptoms, they can report and they can be taken care of. But I mean, aside from that, there's not much that can be done. If somebody doesn't have symptoms, they're not going to be picked out of the line in the screening procedures.
Sean, thanks very much indeed.